Hechtman, Chief Radiation Oncology. So, a long time ago, in a galaxy far, far away, I was a physicist. I worked at Bell Laboratories. I was a professor of electrical engineering. And there became a emotional part of my life where I had this growing interest in people and much less interest in technical things. And at the tender age of 42, I went to medical school. What's different is that I was the old guy with a gray in my beard, and the patients would talk to me and they wouldn't talk to the attending. And I was look down at the ground, and I'd do everything I could to make sure that the patient would look at the attending and not me, and it never worked. So there was always a bit of friction, and I think that's part of the problem with going into the Army when you're 40 or going into med school when you're 42. There were some things about Halifax that I really did love. One is that it treated a full spectrum of patients, people who didn't have two nickels to rub together, and people who are very wealthy. And I think it's part of my responsibility as a physician to have a percentage of patients that really have no means. And I think that's part of my desire to contribute to charity. So that was a very attractive thing. There really isn't anything better in the world than what we have here at this point. So there's been a metamorphosis of this department from some older equipment to something that is really state-of-the-art. And there's virtually nothing we can't do here at this point. We can treat lesions that nobody ever believed you could get to. When surgeons can't do it, they'll very often talk to interventional radiologists, and when they can't do it, then we still can do it. So there's something really exciting about that. And this isn't just for the wealthy people in the world, it's for the indigent as well. And so that's something I'm very proud of. If somebody, for instance, had colon cancer, and the colon cancer was resected, and all of a sudden it shows up to be a liver lesion, which is very common for colon cancer. The patient then has a bunch of people that person needs to see at that point. And what's cool about Halifax is that all of these groups exist here. Let me finish that by saying that virtually anywhere the liver lesion is, we can treat it with probably a 70, 80, 90% kind of cure rate for those lesions. So we're not anxious to expose patients to radiation, but sometimes we're the only game in town, and we have good aim.